So thank you very much for joining today's session. I am Claire Temple. I'm the Digital and Transformation Programme Lead, and I will be joined shortly by my colleague Stacey Thompson, who is Programme Manager at Redmoor Health, and we'll be taking you through the presentation this afternoon. So first, just a little bit of housekeeping. So as you're aware, your microphones and your videos have been turned off just while we go through the presentation. If you do have any questions during the session, please pop them into the chat and we'll go through them. We are recording the session today, just so that you're aware. And if you haven't registered for the session directly through one of the registration links, if it's been shared by somebody else, please make sure that you pop your email address and job title in the chat so that we can make sure that you get all of the information after today's session. And lastly, at the end, we'd like to ask you to take a few moments to fill out a feedback form for the session today. It's really important for us and helps us improve our service for everybody. So today we're going to talk to you about the upcoming requirements for the 1st of October. So following on from our Core Hours Online Consultation webinars, we'll give you information and tips on how to make sure that the online consultations that you offer don't overwhelm your practice, and how to embed them into the practice and the new process into everyday life in your practice, and make sure that you're communicating expectations to both patients and to staff. We'll look at the patient charter and where this should be located on the website, and then we're also going to look at GP Connect and also the update record section of this. And finally, we'll share some offers of support, some additional resources, and a chance to think about next steps. So all of the templates and the resources that we're going to share with you today will all be available via the D&T network in the access category. So that's where to look. There will be some more resources than we share today that we'll share with you on there. So the D&T for 1,100 members, and it includes people like you, product suppliers, subject matter experts, and lots of people who work within general practice and primary care. If you're not already a member of the D&T network, you can scan the QR code that's on the screen there, but also after the session today, you'll automatically be sent an invitation, so you can sign up then. The Digital and Transformation Network came to life last September, so we are now one. And it's an aim to connect everyone across healthcare interested or involved in digital and transformation. There's a wealth of information on there and connections for you to use and to get support from each other. So please get signed up and start using that. So what do we need to do by the 1st of October? So Core Hours Online Consultations must be switched on. The patient charter must be added to your website, and we must be active with GP Connect. So we're going to go through each of these in a little bit more detail. So Core Hour Online Consultations. So as part of the GP contract 25/26, from the 1st of October 25, GP practices in England will be required to keep their online consultation tool open during core hours. So that is 8 AM to 6:30 PM, Monday to Friday. And the tool must be accessible for non-urgent appointment requests, medication queries, and administrative requests like fit notes. Now, NHS England has acknowledged concerns from GPs regarding workload, patient demand and safety. To help address these, safeguards are being discussed, for example, using AI for trigger words to prevent inappropriate urgent submissions. And practices will not be expected to handle urgent requests via this route. There may be some mechanisms to pause access when safe working limits are reached. So the next steps or the updates that we have on this is that GPs in England have voted to re-enter dispute with government over the concerns with the unlimited online consultation requests and that it could become a critical patient safety issue. The BMA is awaiting urgent, clear, pragmatic guidance and says that members are anxious that unlimited online consultation requests mean potentially urgent requests might be missed in trying to determine the important needles from the unlimited haystack of unmet need. However, regardless of the conversations and the decisions being made, we still suggest that you get everything up and online by the 1st of October anyway. This is not going to not go ahead, it just may be delayed, but it won't disappear, so we still need to get this done. So we're following the model of modern general practice access. So the model is designed around the patient experience of access with a choice of channels and better alignment of capacity with need and building the capability in the practice teams. So online consultations is not just an add-on, but it's a core part of how the practices triage patients and deliver care. So it allows patients to submit requests when they need to, in their own words, without waiting on the phone or being tied to certain hours. And for practices, it means better information up front, structured triage, and the ability to direct patients to the most appropriate clinician or service more easily. So in our previous webinars, we talked through this process in more detail, but just as a reminder for you, if you haven't already, we suggest you take this path. So start by setting up a project team that includes clinical staff, admin teams, and patient representatives. And then speak to your patients through surveys or by arranging some drop-in sessions, making sure that everybody's involved early on. It helps to ensure different perspectives and priorities are all considered. And once you've done that, map out your current workflows to identify any inefficiencies or any areas that you could improve. Offer a range of access options, including online consultations via the practice website or the NHS app, as well as telephone triage and in-person support. And then once you've decided on the approach, communicate clearly with patients, use posters, website updates, and social media to explain the changes and how patients should use each access route. Make sure that you communicate the expected time frame that each request will be responded to by the practice and aim to respond within 24 hours, as these requests should be non-urgent, but we need to be giving patients what the next steps are. And most importantly, ensure staff receive the training that they need to use the systems effectively and to feel confident when they are supporting patients through this new process. And it would be helpful at this stage to take some time to understand what tools are available for you to plan the demand and capacity in practice to make the implementation of your core hour online consultations more effective. So this spreadsheet that we've got here is available from NHS England, and it helps you to do that. There is a little bit of manual effort that needs to go into this by inputting the information, but it is well worth taking the time to understand the opportunities that you've got to make improvements and specifically which services may be underutilised at the moment that you can point people towards. There are other platforms as well that have similar tools for this, so you might want to explore them if you already have access to other tools. And then once you've got a plan, map out your process as a visual workflow for the practice. So this will help everybody in the practice understand the new process and who has responsibilities for triaging or for actioning incoming requests. And make sure that you have, like I said, admin, medication query and appointment requests turned on during core hours. Okay, I'll pass over to Stacey.
Thanks, Claire. Thank you very much. So online consultations, that this should be part of everyday practice, and they make it easier for patients to get in touch. So not everyone can phone at certain times of the day. Some people find it easier to write down their problem instead of having to explain it over the telephone. They can also help manage demand. Instead of all the calls coming in first thing in the morning, online consultations can hopefully spread requests more evenly throughout the day and throughout the week. So this means the more urgent cases can be picked up quickly and the routine requests can be planned in, and you've got better overall sight of the demand that you've got. For staff, online consultations can really save time. The forms can collect more of the needed details up front, so the team isn't needing to chase patients for more information. Different staff groups, so your admin teams, your nurses, pharmacists, GPs, can all share that workload rather than everything needing to be dealt with by the duty doctor on the day. So making online consultations part of daily routines also builds patient trust. If the process is smooth and reliable and it works for them, the patients will see it as a good way to contact the practice, not a second best option. And finally, it helps practice get ready for the future. So digital tools like the NHS app and messaging services are becoming more and more common. And by embedding online consultations now, the practice can be better prepared for any wider changes that come up. So we want patients to use online consultations in a way that really helps the practice team understand what they need. To support this, we've worked with patient.info to create a simple leaflet, and that will be shared through the D&T network that Claire mentioned at the start, so practices can give that out to patients. So the leaflet guides patients on how to give the right details, whether they're typing free text or answering set questions depending on the platform. Good information makes a big difference. It helps the practice team get a clear picture from the start without that having to chase for more details. As I said, clinicians are skilled at looking at lots of information and making quick decisions. If patients are guided to share their ideas, concerns and expectations in the online form, the clinical team can triage more safely, allocate requests to the right person and respond in the best way. Many patients worry that the form just disappears once it's sent. So the leaflet explains what happens after an online consultation is submitted, who looks at it and how patients will hear back. It also shows why giving good detail is important, so the team can understand how urgent the request is and make sure that it reaches the right person. So setting up your system so it makes sense from a patient's perspective is really important. You can view how it looks through your test patients accounts and your clinical systems. Check your wording. Is it correct? Does it still reflect the way that your process is now? Is it simple? Is it easy to follow? Make sure that your patients do know what they need to do, how the practice will reply back to them and what to expect next and in what timescale when they can expect that response. You're able to customise your wording that you share with patients in your online consultation admin section. So just a few different examples that you can see there on the screen from different providers. We'll talk later about the patient charter, but the wording in that states the expectation to respond to a patient request with next steps is now 1 working day. So this could be that you book an appointment where appropriate, respond, giving advice or further instruction, or navigating them to another service. Most suppliers can now navigate patients towards pharmacy first or to give self-care advice before allowing a patient to send an appointment request, and that also helps to divert some of the unnecessary traffic. So use your online consultation to communicate, not just collect requests. Make sure your patients are understanding what online consultation is for, how to use it and what happens after they submit that request. Be clear about response times, what problems are suitable and when they should be using other services. So for urgent care, 111 online, pharmacy requests. Promote without driving extra demand. So use your social media, practice websites, waiting room screens to show the benefits of online consultation, that it's convenient, quick access, no need to wait on the phone. Avoid creating unrealistic expectations by clearly stating that it's for appropriate and non-urgent issues. Share positive stories and examples, but balance them with guidance on when to self-care and when to visit the pharmacy. Use your telephone holding messages to remind patients of other ways to get help before waiting in the queue. Messages can direct patients to pharmacy first, NHS app advice or self-care where appropriate. Reassure patients that it's safe, secure and part of that routine care. Encourage the right use, not just more use. So highlight how online consultation can save time for both patients and staff when it's used properly and appropriately. So give clear examples of what issues are suitable. So medication queries, but if you want to direct medication requests through the NHS app, for example, make sure you're describing that. Requests for fit notes, minor illnesses. Reinforce that urgent or serious concerns should be handled by the telephone or emergency services and not appropriate for online consultation. Good communication with your patient builds trust and uptake. So by being clear, consistent and realistic, practices can increase the use of online consultation without overwhelming the system. Where you place your information about booking an appointment through online consultation on your website will make a difference to the number and the quality of requests that you receive. So many patients put the option to book online at the top of their appointment page, but you can see this is a good example from Bay Medical Group in Lancashire, embedding the links further down after giving patients the option to search for their problem, find the best person to deal with it and giving that self-care advice that patients can often be diverted away before they're tempted to just submit a request. It's also really important that we don't use terms like online consultation or the provider brand name on patient communications. Patients just don't recognise that or understand what it means. So instead use terms like book or request an appointment, contact your GP online. Remember to include information directing to your online consultation tool in other areas of your website as well. So, for example, if you want patients to use it to request a fit note, add it to that relevant part of the website. Again, underneath your information that may deter any inappropriate requests, such as that a fit note is only required after 7 days of self-certification. So we also need to make sure we're including other options for contacting the practice for digitally excluded patients and further information about the appointment process. So patients are understanding how the appointment system works in the practice. Patients can use the NHS app to send an online consultation request through your provider as well as through the practice website. So when you're promoting online consultation, always mention the NHS app at the same time. This helps patients see it as that main place to go for booking and health information. So the NHS app can be a one-stop shop for patients. They can book an appointment, request a prescription, check records and test results and get health advice all in one place. Having a clear route, such as the NHS app, reduces that confusion that patients might have. They don't have to remember different links or different systems. And encouraging use of the NHS app also supports national NHS plans can reduce the practice costs around SMS messaging as well. So make sure your website, your waiting room posters, social media all give that same clear message. You can request an appointment online through the website or even easier through the NHS app. So this joined up approach hopefully makes it simpler for patients and helps your team manage that demand a bit more smoothly. Social media is a quick, simple way to keep patients up to date. You can use it to tell patients about changes to services. For example, if your booking system or your opening hours for it to change. It's a really good place to promote services patients might not know about, such as pharmacy services or self-care advice. Use clear, friendly posts to explain any booking processes, tell people how to request an appointment, what will happen next, and the timescales when they'll hear back. So messages should be short, easy to read, avoid medical jargon, and remind patients that online consultation doesn't always mean a same-day appointment. It will help manage expectations and reduce extra demand. So visuals like the example shown can just make posts stand out and help patients remember any key messages. We do have a social media managed service that can help to support practices, ensuring the right message goes out at the right time. So if you'd like to know anything more about that, please do pop a comment into the chat box or contact us by email, and we'll happily have a chat to see if we can help you in more detail on that. Don't forget about changes that will be made in the practice and the support that you need to provide for staff as well throughout any changing process. So your Monday mornings are still likely to be your busiest period, where the patients use online consultation or the telephone. Lots will still wait till Monday morning to get in touch. If people have submitted things over the weekend, you're dealing with that on Monday morning. So this is the heat map from our Digital Maturity Index showing the current number of online consultations submitted. So this data is from July of this year. You can see that 6 a.m. to 10 a.m. on a Monday morning is still the highest area of demand. So plan your staff cover across the week. Make sure that you've got admin and clinical staff to deal with the demand that you've got. An idea could be to set up a bit of an online consultation hub in practice. So you've got a clinician and handling the online consultations, working alongside an admin staff as well, dealing with the admin non-clinical queries. Use of it across core hours can take pressure off receptionists and support staff well-being. Less phone calls coming in does equal time to do other tasks. So if your telephone demand is going down, your receptionists can focus on the other important tasks. They might need clear guidance at first, but it will, because that will all feel like a big change in the way of working. So remember, you will need to continually review and improve the process that you've got for online consultation. So put a process in place to do this regularly and be prepared to change. Be agile, stick to new appointment system guidance. Make sure you're having a backup plan for any requests that come through unexpectedly. So, for example, you may want to create a template for medical requests that come through the admin route with practice process for dealing with these to keep your communications consistent. Keep your patient communications active. Listen to the feedback that your patients are telling you. Keep reviewing your telephone data, your online consultation data to support progress. Use it as evidence to further promote. Celebrate good news and share that with patients and with staff. Create a support system with other practices, so share ideas, share learnings, and think about how you can collaborate with those other practices in the area to make online appointments more accessible. So moving on to patient charter. So the You and Your General Practice has been developed to help patients understand what to expect from the general practice, how they can best get the best service from the general practice team. It also enables patients to provide feedback or raise concerns with the GP practice, with Health Watch or with ICBs. So the You and Your GP document published by NHS England can be found here. We've got a link in there to the guidance for you, and that is the patient charter that's been worked on over the last year. The contract requires every GP practice to have a link to this documentation on their website no later than the 1st of October 2025. So practices should ensure that local policies, appointment policies, complaints procedures, registration, feedback align with this document and what it says inside. So you may need to review your current policies to update them. So, for example, as I mentioned before, if a patient requests an appointment through the online consultation system, the patient charter wording explains that a practice can't tell a patient to call back the next day. So the practice must navigate the patient, tell them what will happen within one working day. So that doesn't mean that the patient needs to be seen or dealt with within a working day, but the patient needs to know what the plan is for them within that one working day. You can add the document to your website yourself, or you can ask your website provider to do it for you. We suggest that you would add the link into the page in the policy section of your practice website. Moving on to GP Connect, this is another requirement from the 1st of October that contractors will be required to ensure the following functionality is enabled. So GP Connect Access Record is the functionality that allows NHS providers and private providers with explicit patient consent to have read-only access to a patient's GP record for direct care. And then the update record functionality, which is where it allows community pharmacies, registered professionals to send consultation summaries into the GP workflow. So this is a diagram from GP Connect, just explaining how it's meant to work between healthcare workers and patients. And there's a link on that slide for more information where that comes from and how you can find out how the integration works. We've also included some implementation guides from both EMIS and System 1 for GP Connect. So again, these resources will be shared with you through the D&T network, so you can ensure that you've got system all set up correctly within your clinical systems. So community pharmacy consultation summaries, including observations, notes, any medicine supplied, will arrive in the general practice workflow in systems for filing into the GP patient record. So then a workflow task is created in the GP IT system for every community pharmacy consultation summary received, so it's visible to the practice before filing into the GP patient record with one click. So your community pharmacy team will capture consent that the patient's happy to share details of the consultation with the practice. Patients will be made aware a consultation summary and any medicines supplied will be visible in the NHS app and other patient-facing services where it's been enabled by the practice. So in the case of contraceptive consultations, a patient can choose to not have this information shared. The joint GPIT committee, supported by the BMA, have raised serious concerns about the rollout of GP Connect for the update record functionality, particularly in that context of pharmacy first. So they've highlighted problems such as incorrect coding, including pregnancy codes being wrongly added to record, and there are around 15,000 records under review. They say currently they lack confidence in the system's safety and accuracy. So the committee stresses that NHS England must take clear accountability for the information model, provide a written editorial policy on coded data use, and establish transparent assurance, audit and data quality processes, including root cause analysis of past errors before practices are required to adopt it. So are still conversations going on about this. They also call for clarity on data protection liabilities, data flows, audit trail, and opt-outs. So whilst practices are contractually required to switch on by the 1st of October, the IT committee, they are urging NHS England to pause this deadline until the governance, the safety and the quality issues are resolved. So we're expecting more information on that. Claire.
Thank you. So just thinking about, I know we've thrown a lot of information at you about what is to come in or on the 1st of October. But just when you're implementing these parts in the practice, think about what can be done at a PCN level to make this easier for both staff and patients. So for things like Core Hours Online Consultation, you might want to offer some PCN-wide services available from shared roles through your online consultations. So have a think about that and how you can better work that with your online consultations. Your patient charter, you might have a PCN website that can host shared policies, including the patient charter. So you can create a link to that from your practice website. So all of the updated information is contained on your PCN website. So that's one less job for somebody in your practice. That might be something to think about. And then you may be able to work with other practices in your PCN to make sure that you've all implemented GP Connect and update record parts in the clinical system correctly. So we have got some guidance, like we said, that we'll share on implementation in clinical systems, but it might be worth just talking to the rest of your practices and find out that we've all implemented it in the same way and make sure it's all up and running. So what are you going to do next? So a good place to start, if you haven't already, is mapping your process or your patient journey, just to understand what changes can be made in your practice, and what opportunities you might have, what services you've got underutilized at the moment that you may be able to divert some more patients towards. Are you going to plan your patient and your staff communications or improve them? So getting that information out there to patients that explains exactly what the online consultation system is by using just the request or book appointments rather than online consultations or the provider name. Make sure they understand what they can use it for and when is most appropriate and when they should just directly contact the practice for urgent issues. Or do you want to reach out to Redmoor Health for support? So we have a Core Hours Access toolkit that we have that will guide you through the steps to implement online consultations. That is available in our D&T hub, but we can also provide some hands-on tailored support, whether it's over a day or over a longer period of time. We could also attend PCN or practice meetings just to give you that little bit of extra to support and see how we can help there. But whatever you decide, I hope this session has provided a little bit of clarity and practical guidance as to how to make those online consultations, patient charter and GP Connect, that little bit easier for you to get implemented. As I said, some of the resources that we've suggested in here and you might find helpful are available in the D&T hub. If you don't have access to the D&T hub, we're offering a £99 a month support package. That includes this, along with a monthly call with one of our team to support your practice, some targeted monthly webinars and digital guidance, and a monthly toolkit like this one there. And it also gives access to that digital maturity index that we got the information from. So if you'd like any more information on that, please get in touch. It gives you a practice level snapshot and understanding of your capability once you've been through the initial digital maturity assessment. And it's got a knowledge base, which you can see down there at the bottom, which is tailored resources that can help to guide each practice in building capability where it's most needed. If you'd like to know more, please pop something in the chat or send us an email. Before we just move on to, I've seen there's a couple of questions in the chat. We'd appreciate it if you could fill out a feedback form for today's session. It is really useful for us to make sure that we're getting the messages right and we're giving you enough information on the right things. Also, as a bonus, if you fill it in, you'll go into a draw to win a £25 Amazon voucher, so it's worth a couple of minutes of your time. So yeah, thank you for joining us today.